Welcome, everyone. Let's give it just another minute or two. Just one more minute. Okay, let's go ahead and get started. Welcome to the power of local communities to establish partnerships. So before we get going on the presentation, we just need to do a little bit of housekeeping. Just if you could change, if you haven't done so already, it looks like most people have, but if you could change your name to include your state so we know who we are talking to. And if you called in on your phone, which at this point, it doesn't look like anyone has, so I won't go over that. And then we do, if you have any, we're going to have some time for questions and answers a little bit later in the session. But if you have questions along the way, please go ahead and use the chat to do so, and just keep yourself on mute when you're not speaking. Okay. So, and just a reminder before I turn it over to our state presenters, if you want to go ahead and put your view in speaker mode, you'll have the presentation and the speaker in great view. So first, just to kind of give you a run of the session, first we're going to have Virginia present, and then we will move on to Louisiana doing their presentation. And then we will have breakout rooms. So with the breakout rooms, are going to be self-select. So you're going to have opportunity to go ahead and jump into the room that you'd like to learn more about. And then we'll have questions and answers. And if there's any ideas presented in the breakout rooms, we can share those out. And then we'll have closing. So let me go ahead and introduce Erin Carroll is the Executive Director of the Early Childhood for the Virginia Department of Education. And Virginia will be sharing the systems they have implemented to support local leadership through a community model.
Great, thank you, Stephanie. I'm excited to be here this afternoon, or whatever time of day it is, wherever you are calling from. As Stephanie said, my name is Erin Carroll, and I'm the Executive Director of Early Childhood at the Virginia Department of Education. And we'll spend the next few minutes talking about how we have used the PDG Foundation to really institute some local community partnerships in Virginia. I'll be really excited to then turn it over to Lizzie, who is a great representative from the state of Louisiana and can share what that looks like in her state as well. All right. Great. So just a refresher of what we're hoping to accomplish in this session. So our goals are that folks can gain a foundational understanding of the key functions of Virginia's preschool development community networks, consider the strengths and challenges of the community network structure that Virginia uses, and then hopefully as we transition to breakout rooms or question and answer, think about how this is similar or different to some of the structures in your own state or region. So we'll spend just a little bit of time doing the who, what, when, where, why of our Virginia community network structure, what their key functions are, and now that we are 3 years into this project, what some of the key successes and challenges have been. So most important to just emphasize here that when we talk in Virginia about our PDG project and grant, there is nothing related to that grant that does not get done, operated, instituted outside of the community networks. Our PDG community networks really are the centerpiece of all of our local collaboration and coordination. And as we've progressed along the PDG grant, we've been really fortunate to use these PDG networks to really lay the foundation for a unified Birth to 5 system that's now represented in legislation. It's now represented in our state code and regulation. So we're very proud of our PDG community networks, and we really think of them as the driver of local ground level change and coordination across all of our Birth to 5 programs. So our PDG community networks, and I will talk a little bit more about how many we have and what they do as we go along, but they look very different at each community level. There are some characteristics that are the same for everybody. So all of our PDG community networks include representatives from the Birth to 5 community that's included within their region. Sometimes this is one county, that's rare, but when we're talking about some of our very big counties in Virginia, that might just be one. Sometimes it's 3 or 4 counties, and sometimes it's as many as 10 or 16 counties. But whatever their regional footprint is, there are representatives from every Birth to 5 publicly funded provider in that network. All of our community networks have a community network lead. So this is a different representative depending on the community. It's most often in Virginia a community nonprofit, though we have some that are school divisions, and have had different folks raise their hands as we've progressed along. But this community network lead is the group that the Virginia Department of Education works with to provide funding to perform the key functions of our PDG community network, which I promise are coming up in just a moment. We then have our members of the PDG community networks. And so, as I mentioned, this really includes all of our publicly funded programs within the region. So that is publicly funded childcare and family day homes, public schools that have a pre-K program, Head Start. Those really make up our Birth to 5 network in Virginia. And then some networks, most networks, have done a really good job also engaging some of the other support systems within that region. So this is sometimes other local early childhood professional development groups, health service groups, other local nonprofits who want to have a stake and a voice in the PDG community network functions. The next one. So in Virginia, we have been under a multi-year effort to unify our Birth to 5 system through the work of the PDG community networks. We've been really focused around 4 areas of work in order to do that. And as I mentioned at the beginning, it is really the PDG community network leads and their members, the publicly funded programs, that are responsible for moving all of these big objectives that resulted from our PDG grant and needs assessment forward year over year. So what does this mean in kind of a brass tacks way? Each year, our PDG community network and the organizations and programs that are a part of that network sign a set of assurances to complete activities in 4 key areas. And so those include building relationships with all of the publicly funded programs within the site, supporting quality. And so by being the on-the-ground implementers of our non-optional quality measurement and improvement system, providing coaching, assessing the quality needs within a community, increasing access by hosting and providing coordinated enrollment pathways for the PDG community network, and then engaging families in all parts of the Birth to 5 system, responding to local needs, as they are assessed via our more routine family engagement assessments. And I saw a question, do we include home visiting or early intervention in the networks? And yes, so that is a option for those groups to participate. They aren't funded to do any of these activities, but in many of our regions, we do have representatives from home visiting and early intervention attending just to facilitate some of those connections. The assurances largely are describing actions for the publicly funded Birth to 5 programs to complete though. So the PDG Community Networks are our foundation, and they have been with us now for 3 years, which is hard to believe as time just keeps going faster and faster. So we launched our first set of PDG Community Networks with the initial PDG grant, so prior to these renewal years. So year 1, we forged forward with 10 brave PDG communities that were covering 27 counties and cities and 30% of the state. And when I say 30% of the state, I mean within those 27 counties and cities, about 30% of the publicly funded programs in the state of Virginia were represented in those first 10 PDG communities. We nearly doubled last year, or we did double last year, both in number of counties and percent of the state. So last year, despite the incredible challenges of the kind of first full COVID year, we did see a lot of folks opt in to joining our PDG Community Network structure, expanding to be available to over 60% of the state. You can see that we have a much more significant uptick in counties than in PDG communities. And one thing that we've really seen kind of organically evolve in Virginia is a move towards the regional structure. So having one community lead or network pick up additional counties instead of folks kind of going out on their own and starting a new network. This has a lot of probably reasons for it. Virginia has a strong existing regional structure. We also have a lot of small counties around our state, and many folks have opted to kind of combine or join on to existing structures instead of form their own network. Nonetheless, we have progressed still this year, so up to 114 counties and cities. Realizing that probably isn't a lot of context to people who don't live in Virginia. I think we have 130 something counties and cities in the state of Virginia. So nearly to every county and city in Virginia, and 84% of the publicly funded programs have the opportunity to participate in the networks. So really rapid expansion, but we are not done yet. So our current 17 PDG community networks, you can see, and this has been a lot of work on the ground to get this far. We have covered quite a bit of space, and you can see over in the left portion of the state that our biggest geographical network is in Southwest Virginia. This is a less populated area, and so we see that that is one place where folks are really kind of joining on to that existing network and getting bigger in that way. Whereas some, we can see that bright pink up there is Fairfax, which of course is a big region of its own. But we have big plans for the future of PDG community networks. So by next July, we will have this available to 100% of the state, have the opportunity for them to join a community network. Right now, it has been optional for those that it's available to. However, that is changing. And by July 2023, 100% of publicly funded early childhood community networks will be required to participate in the community network activities. There are a few driving features for that, one of which I mentioned kind of briefly before, but Virginia has, since the inception of PDG, passed some state legislation that establishes a non-optional quality rating and improvement system. So every publicly funded early childhood program will be required to participate by July 2023. While our PDG community networks do a lot of other activities, one of the main things they do is implement on the ground level our quality measurement and improvement system called PDG B-5. And so we will be growing significantly in membership of these networks going forward. This is exciting, but makes us really glad that we have had several lead up years to kind of get the structure and formula right. So a little bit more about the key functions of PDG Community Networks. So this is again, and this is the same 4 areas that we shared before, just with some cute graphics to explain them a little bit better. But there are 4 key areas that we talk about with our PDG community networks and the work that they are asked to do. You can also see that we have placed confronting racial inequality in the middle, as this is a key focus of our network activities, but is truly embedded in each area of assurances and activities that we do. So the building relationships down there in the left corner is really the foundation and centerpiece of all of this work. We know that the building relationships and getting a strong and solid foundation of collaborative partnerships is the beginning step to doing all of this work. And so this is what we really hope to support community networks to do. This is reaching out. This is, at this point, getting folks to opt in to being a part of the community network, having some routine meeting structures, communication structures to do that on the ground outreach that I'm sure many folks on the phone know is no small task in and of itself. Kind of going clockwise, increasing access. There's a lot that goes into this. One of the main things we talk about in this area is coordinating enrollment. So our PDG community networks are asked to assess and make a plan to take positive action towards a coordinated enrollment for their region. This looks different in every community. As you saw, some of our PDG community networks look like they're covering about half the state geographically, and some of them are limited to 1 or 2 very populated regions. So the progress and the steps that happen on an annual basis here look really different depending on the circumstances, but this is one goal that we do support and encourage for all the networks, regardless of size and structure. The next goal, engaging families. This is a really locally driven goal. So we added this actually in our renewal application for PDG. The first year with that first set of 10 PDG networks, we just had the 3, build relationships, strengthen quality, and increase access. And we heard loud and clear that there was a big gap missing for Virginia's families, and that we needed to include engaging families as one of the key 4 activities that our networks were completing. So again, this looks even more different at the regional level than increasing access. Again, depending on kind of the size and structure. What we do at the state is ask communities to assess the activities that they're doing to engage families and come up with milestones or practices that can be implemented over time in a reasonable scale to increase family engagement for their locality. And then the last one, strengthen quality, as really where it all comes together. So our PDG community networks are charged with several activities related to strengthening quality. This includes helping our network, the sites complete an inventory of the activities they're doing, figure out what professional development is existing, what might be best for them, or where we could grow and improve as a state. We've also put a large emphasis on both the use of the class observation tool and the use of high quality curriculum for our local, our publicly funded Birth to 5 programs in Virginia. So the PDG Community Networks complete 2 class observations for every single classroom within their network each year. These are the foundation of our non-optional PDG B-5 quality measurement and improvement system, as well as support for understanding the needs of curriculum, which we're continuing to figure out how to support at a statewide level. One thing that we continue to refine as we go along is what the role is of the state education agency in supporting the network functions. So the VDOE is really fortunate to have an amazing partner in the Virginia Early Childhood Foundation who facilitates and does a huge amount of legwork to support the PDG community networks on the ground. So we work closely with VECF, Virginia Early Childhood Foundation, to support the networks. We can kind of break our interactions or areas of support into 3 areas. The first is identifying who the network is, who the lead is, and what the funding is. So we fund through VECF, who then helps us support the networks to complete the set of activities I described. We keep in very close touch with our community network leads. So we have quarterly technical assistant convenings of all grantees. These were for a short period in person. We have pretty successfully shifted to a virtual format. And then on more routine, keeping in touch, we have weekly office hours that we have for our networks to call in, a weekly newsletter, and then a use of an online platform called Zoho Connect that the networks can use to kind of share resources across one another, and is really used just about every day. People are in there posting and sharing information. And then finally, another key feature of the way that we work with our networks is through information gathering and response. So we have developed a data system that we use dispersed through the community network structure that really gives us a good set of insights into what's going on at the community level. We use that information to figure out what we need to be focusing on and understand the state of Virginia, as well as quite a few surveys that we do throughout the year on a calendarized basis to really inform policy decisions, practice decisions, and make sure that we're getting the right voice from the field. And the last slide I have in this section is really what are we thinking about post PDG? So again, I don't know if time has flown as quickly for everybody, but it's gone really fast for me. It's hard for me to believe that we're already coming up to year 3 of this 3-year project. But I do think that we have been pretty strategic and hopefully continue on this path of embedding the PDG community networks into Virginia's long-term vision for a unified early childhood system. So I mentioned that since the inception of PDG, Virginia's done a lot to unify the early childhood system, moving the oversight of childcare and Head Start to the Department of Education, and some work to develop this unified measurement and improvement system. So deeply embedded in some of those legislative statewide moves is the work of the community networks. So post PDG, we know that community networks will be essential in implementing PDG B-5, our unified measurement and improvement system that will be statewide in July 2023. Community networks have, as we've gone along through this unification framework as a state, have really built capacity to complete the really important functions such as coordinated enrollment and local family engagement strategies. We have considered what are the additional funding sources to continue to do this activity, and know that a lot of the work that the community networks are doing is supported through other funding streams that we access, whether that's state funds, childcare funds, or otherwise. And so we're trying to do a little bit of forward thinking approach about that. And then I see a question in the chat that gets to my last point here. So Virginia is in the process of shifting to a formalized regional approach for early childhood networks in 2022. So what we have called and branded the PDG Community Networks will be shifting into a structure called Ready Regions, which is a set of currently nine regions that will cover the entirety of the state. And that is really essential to our approach to making sure that we get to every single locality, site, center, family day home to be included in this quality effort related to Virginia. And so this regional approach, we are seeking state and federal funding to support that as a sustaining feature of Virginia's early ed system. And this is my last slide. I wanted to end with a little bit of reflection. I know there was a lot of information to throw at you. So, you know, as we have gone along, the networks look really different every year. The same 4 key areas of work, but we have been fortunate to really have a two-way set of communication from the networks to really keep a close pulse on what's working really well. I would be remiss to not mention and acknowledge the flexibility that the networks have demonstrated in unprecedented challenges. Probably don't even need to put in the parentheses of COVID. I'm pretty sure everybody knows exactly what I'm talking about, but really being flexible, adapting the way we do things. You know, a lot of this work has relied on in-person activities and seeing everybody really shift, you know, on the drop of a dime to make things work, to continue to stay in communication when we know the childcare sector is feeling challenges that we have never experienced before. The on-the-ground understanding and the way in which the community networks have been able to charge themselves with sharing their findings, and the feeling and the tone from the field is really a huge strength and makes us a more responsive state agency. We've seen the community networks be huge advocates for equity. They're the first to tell us when something doesn't seem fair or could be overlooking something. And that's something that, you know, sitting in Richmond, we need, and a huge area of strength. And then we've also really seen the community networks seize on the opportunity for peer learning across communities. So I mentioned Zoho Connect and our weekly office hours. It is very neat to see folks not just come and ask the state or VECF for help, but also kind of produce their own problem solving or information sharing across the networks, which is again a testament to their dedication to the work. I think as far as areas to work on, you know, we have expanded a lot in regional reach for Virginia, but we're still working on engaging every program in every community in Virginia. Depending on, you know, some of the history of each region or network, sometimes we see really high participation from schools. Sometimes we see low participation for schools. Sometimes we see high participation from family day homes. Sometimes we see low participation from family day homes. So working as a state to make sure that we're getting the right information out to all of our providers through the right channels with the right messaging is something that I think as a state, we're gonna do a lot of work on this year, definitely in preparation of 2023. We have a lot of this baked into some online data systems and have had to continue to work on our support for using technology across all programs. In some cases, that means providing technology for all our programs and identifying the right communication channels for each of our programs. And I don't think that I have another slide after that. So let me see if I can stop my sharing. But I look forward to hearing more questions from folks in our breakout rooms and at the end. Thanks.
Sorry, I was still on mute. Thank you so much, Erin. That was a great presentation, a lot of wonderful information. Y'all are doing some really good work there in Virginia. So next we're going to shift to Louisiana, and Louisiana will share how their Ready Start networks have raised community awareness of the importance and need for early care and education. So I'm going to turn it over to Lizzie Kosei, the Director of Access Strategy within the Early Childhood Strategy Office of the Department of Education.
Thanks so much, Stephanie, and thank you, Erin. It was great to hear about all of the wonderful things going on in Virginia and how much you've leveraged the PDG grant to move the community network structure forward. I'm going to share a little bit today about Louisiana's approach to building capacity and driving innovation at the local level through both community networks, similar to Virginia's model, and Ready Start networks, which was a new initiative that we were able to start after receiving the initial PDG grant. So I'm going to give you a little bit of background about early care and education in Louisiana for context, and then I'll introduce you in more depth to the Ready Start network model, how that's manifested itself, and some wins we've had so far. So in Louisiana, what you're reading on the slide might be similar to what you're experiencing in your own states, but prior to 2012, our early childhood system was incredibly fragmented. Few children were ready for kindergarten according to kindergarten assessments. These programs were very siloed and didn't communicate with one another. There was no coordination of the multiple programs that serve young children. There was inefficient use of funding. Quality was not measured in any way, or was it measured in a unified approach? Families had trouble navigating this system. And finally, like I said before, children were simply not ready for kindergarten. And in 2012, Louisiana enacted what we call Act 3, and we refer to Act 3 all the time still. It was a set of sweeping reforms for our early childhood system, allowing us to coordinate, strengthen the system, really kind of push a very unified quality approach. So since 2012, we've made a lot of progress. First and foremost, all early childhood programs that serve care and education from that perspective are located under one governing body, which is the Louisiana Department of Education. Previously, licensing was somewhere, the CCAP program was another place. Everything was just, like I said before, fragmented and siloed. So now we're all in one place, the LDOE. Secondly, we established community networks in every community in the state. And I'll talk a little bit more about what those community networks look like. But a lead agency administers that work in every community in the state. In our state, it's typically aligned with the parish level or county level, as the rest of the country calls it. We call them parishes in Louisiana. There are 66. So quite a few more, but they're a little more focused because they're typically on the county or parish level. We've also implemented a statewide unified quality rating system. So every publicly funded childcare classroom, Head Start classroom, or publicly funded pre-K classroom participates in one unified quality rating system under the CLASS tool. And finally, we've aligned our quality improvement supports to that quality rating system. So I'll share a little bit about what that data has looked like and how we've made improvements in quality over time. But I can say that we have quite a great approach for helping sites that are not meeting our minimum standard for quality called the Site Improvement Plan. So we're really working very closely with those sites, working in conjunction with childcare resource and referral agencies. And we've really seen the needle change in the direction of higher quality care for children since these implementations have been put into place. So like I said before, very similarly to Virginia's, just a few slight differences here and there. Louisiana implemented the community network structure. So every community network unifies the childcare centers that are eligible to receive public funds, Head Start, and then publicly funded pre-K. That community network lead agency agrees to conduct the administrative functions of the network, including serving as the fiscal agent. At this point in time, we use CCDF dollars as well as state funding to help support this initiative. They also coordinate class observations for every infant, toddler, and pre-K classroom. Like Virginia's, it's twice a year, once in the fall and once in the spring. And finally, they coordinate a child count. So every publicly funded program is required to report a child count by age, by funding type, to their community network, who in turn submits that to the state level. They're also required to coordinate enrollment at the local level. And finally, they are required to ask for additional funding through a state funding application that we have every year known as Super App. And that's a chance for them to apply for pre-K4 seats, in addition to quality supports and other opportunities. So since we launched the community network model, you can see we have this rating system that buckets people into unsatisfactory, approaching proficient, proficient, high proficient, or excellent. And if you look over the past 4 years, you'll see that every year we've gotten fewer and fewer sites that are either unsatisfactory or approaching proficient, and more sites that are on that other end than we like to see. And so I think that is just a result of the commitment of our community network leadership, the commitment of the state to invest in curriculum, to invest in training in the class tool, and how to improve adult-child interactions. I will say the 2019-2020 data is a little interesting because it reflects the department's hold harmless approach, which allowed sites to opt between the higher scores over the past 2 years. That's because most of our class scores were interrupted in the spring of 2020, and therefore a lot of sites didn't get a second observation in. So just wanted to add that little caveat. But as you can see, between communities, site leaders, and early educators, they have focused relentlessly on these quality improvements and made gains every single year. I will also add, I don't have the slide with the breakdown in this deck, but if we looked at public pre-K, Head Start, and childcare and the improvements that they've made over time, they have also steadily increased at each of the different program types. So this slide is a little more bleak. Besides the gains, and despite these gains in qualities, rather, there has been little to no movement in the percentage of children that we're serving in early care and education settings. As you can see, Louisiana is doing pretty well with our 4-year-olds. We have a great state-run program called LA4, and we're serving about 90% of our economically disadvantaged children. I will make a note that this is from fall of 2019, since that was the last most typical year that we've had. Fall of 2020 data just wouldn't necessarily paint the picture that we want to paint, but or a more accurate picture, I should say. But fall of 2019, we are doing pretty well with our 4-year-olds. There are a few that are being served in low quality programs. And what that means for us is they are not proficient yet. But as we go down and as we go younger and younger, fewer and fewer children who are in economically disadvantaged families are being served in these publicly funded programs. This is a very huge driving motivation for us to create Ready Start networks, which I'm going to talk about in just a moment. Because this is our inspiration. We want to get these numbers up. We want to serve more and more children. Our quality is improving, but our access has really remained stagnant. So we're trying to figure out how to address that at the local level. So like I said, there's been improvements. There has been an improvement in coordination. Our community network structure has been going very well. But these community networks need to be supported and empowered to drive faster rates of improvement. We believe that those closest to children are the ones best able to make decisions on their behalf and the ones who are potentially able to move the needle faster on behalf of our youngest learners. So the Louisiana approach is to support Ready Start networks by giving them authority, responsibility, and resources to drive faster rates of improvement. So with that, we hope that these networks will collaborate with new partners and develop strategies to find funds at the local level. I like to call Ready Start networks our community networks 2.0. They're still doing what a community network was established to do. They're kind of just taking things to the next level. And so in Louisiana, we have an early childhood care and education commission that determined that the Louisiana legislature needs to invest $85 million, and there would need to be an annual increase to serve the number of children we want to serve birth to 3. So obviously that's a very large number. The Louisiana legislature has committed some funding to serving birth to 3 students, but not quite to that $85 million number that we need. So what we're doing is choosing to also support and empower and incentivize local leaders to raise revenue and to make investments at the local level in early care and education programs. So in 2018, right before we were awarded the preschool development grant, the initial one, the legislation passed and created the ability to fund these pilot programs that we are now calling Ready Start networks. We wanted to empower those local communities to expand access to high quality care and education. So Ready Start networks are established and they follow the 4-pillar model. So every single Ready Start network is really guided by this model, and it's been made possible by the preschool development grant. And for us to really implement this and to help guide them, provide resources to them for them to implement this model. But first and foremost, they develop a blueprint to guide their network success, also known as a strategic plan. They create a coalition of a variety of stakeholders with diverse backgrounds to really be their advocates and champions on behalf of early care and education with the broader community. They are establishing advisory councils to guide decision-making. And finally, they're looking for strategies to find and develop local funding to support the implementation of their big goals that they've established in their blueprint. So you can see from this map that we have had quite a few people raise their hand and say that they were interested in this. There are currently 36 Ready Start networks in 4 separate cohorts. The very first cohort launched in January of 2019. So we've made a lot of progress since then in terms of the number of people who are interested in this. More than half of the state's early childhood networks are Ready Start networks. They're working to improve access to quality care and education. So I do want to point out in this map that we've got quite a variety of networks here. You'll notice that East Baton Rouge Parish, which is where the city of Baton Rouge, where I am, is a Ready Start network. So is Orleans Parish, which is where New Orleans is located, Caddo Parish, which is where Shreveport is located. So we've got we've got most of our biggest cities accounted for as a Ready Start network now. But we've also got really interesting parishes like Iberville, like East Carroll, like Webster. These are a lot more rural. And so what's really neat about this model is that we're finding that there have been successes in all of our Ready Start networks, especially the ones that are in the first couple cohorts, because they're a little more progressed than the ones in the later cohorts in terms of what they've accomplished. But we're finding that the model is working and applicable to both rural and urban and suburban areas. So it's been really neat to see that so many are willing to raise their hand to be a part of this process. So many of these leaders at the local level really believe in what they're doing and want to bring their community to the next level and to serve more and more children. So I'm going to dive a little bit more into each of those 4 pillars of Ready Start networks. The first one being the blueprint. This is their roadmap to success. They establish a bold local vision that really drives their actions, their strategies forward, addressing their most pressing needs. So this is a very community-focused blueprint. We want them to do it collaboratively with other stakeholders and program partners, making data-informed decisions so that they do an analysis, a little bit of a mini needs assessment, you can say. They do an analysis looking at their data, looking at what their greatest needs are, and they establish goals to address those biggest needs, the biggest gaps in their community. They're also creating public-facing blueprints because we want it to be a tool for them to use to help guide their direction and their vision, but we also want it to be a tool to help guide awareness in their community. So a lot of folks have made brochures or one-pagers of the public-facing blueprint to kind of spread awareness about early childhood. And I will say this directly ties into the next pillar that I'll discuss in just a minute, the coalition, because folks are using blueprints when they approach people in the community and saying, this is why this is important. Take a look at our goals, take a look at our vision. How can you help support us? Finally, we have had Ready Start networks who have successfully used their blueprint to help apply for grant funding or to pursue additional funding opportunities. So when they approach someone, they're applying for a grant, they can share, we have a very clear vision and we want you to help us accomplish it. And I think that their blueprints have really been helpful there. So the second pillar is coalition. This is probably one of the most important ones, although I can make an argument for each of the 4. But coalition is all about those Ready Start network leaders bringing a diverse group of stakeholders to the table to be more informed about why early childhood is so important, to be their champions and to be their advocates. So when we first launched Ready Start networks, and what we're continuing to do is we equip the Ready Start networks leadership with technical assistance and with a partner, a consulting firm that helps them list out various stakeholders in the community that would be great supporters, whether it's business community, faith-based community, if they have a university in town, the research-based community. There's a lot of different folks they want to bring to the table, because we think that the more folks who are aware of early childhood, who know about how important it is, the more opportunities there are for the Ready Start networks to pursue. So, like I said before, these Ready Start networks are engaging with a variety of stakeholders. Before COVID happened, a lot of them were having really great meet and greet kind of sessions, lunch and learn sessions. I think they've pivoted and done a pretty good job of doing as well as they can with this virtual platform as well. And the aim of this pillar is to have more community members interested, invested, and supportive of the aims of the Ready Start network. The third pillar is to institute an advisory council. So this is kind of a smaller group, a subset of, I guess, the coalition, you could say, that advises and helps the Ready Start network make decisions related to the mission, vision, and goals that they established in their blueprint. So we want these advisory councils to be representative of the community, inclusive of members with diverse backgrounds. We ask our Ready Start networks to host quarterly advisory council meetings to strategically address problems and challenges, trying to problem solve for different things. And we do support them as well in this pillar by, we had a contractor who helped them develop sample bylaws that they could use, because a lot of folks hadn't done this kind of work before or developed bylaws. So that was a really helpful tool that we were able to do thanks to the preschool development grant. So what we've heard from some of the networks who have implemented this and who have found a lot of success is, wow, I didn't know how helpful it would be to have a business partner at the table, or to have someone who has experience in fundraising, or to have someone who has connections to the United Way. There's just, it's a lot about connection forming and a lot about new opportunities that get presented based on who's at the table. And finally, and this is the hardest one, is local funding. So we're asking Ready Start networks, once they've done those first 3 pillars, to then try and pursue local funding that would support the goals of their blueprint. That could include local government funding, funding set aside from the parish council, for example, or the mayor's office we've seen in a couple of places, grant and foundation funding, and finally local donors. And I can say that of the Ready Start networks who have experienced success in this pillar, it has always stemmed from someone in their coalition or a connection that they made through someone who was in their coalition. So that, again, like I said, was a really powerful pillar to just make connections in the community and figure out more opportunities. So this one I would say is the most challenging, and one that gives some of them a little bit of heartburn, a little bit of pause. But I do think I can share on the next slide a little bit about how some of them have been successful with this 4th pillar and how we plan to help them in the future with this 4th pillar as well. So 3 of our Ready Start networks this past year secured over $4 million for local birth to 3 seat funding. And that met a state dollar for dollar match. We have an early childhood education fund that will match local funds being raised for birth to 3 seats. And I will say they were all in urban areas. So we still have a ways to go with figuring out how to support our rural communities with these pursuits. But the New Orleans area had a partnership with the parish council. The city council set aside a significant amount of money for them for seats. They've actually been doing this for a couple of years, and every year I think they've seen just how important it is, and they've increased the amount that they've set aside for early childhood seats. In Caddo Parish, which is where Shreveport is, they achieved success through a local foundation who just took a great interest in this cause and raised over $1 million in donations. So I think what their next step is to figure out how to make this sustainable and what this will look like in the future. And then finally, Jefferson Parish, which is a suburb of the New Orleans area, also got dedicated local funds from their parish council. So like I said, this kind of looks different in every place, but like we are going to try and help both our rural and our urban communities seek this funding in the future. And I'm going to skip ahead to one of the 3rd bullet point, which is that we're going to be helping Ready Start networks with those funding plannings and sustainability efforts. And that's been made possible by stimulus funding. We also have Ready Start networks who are placing seats in diverse delivery in type 3 centers, piloting what we're calling the Birth to 3 Seats initiative. And that is made possible through PDG and also stimulus funding as well this year. And that's been a great local model that we hope will impact maybe some of our legislative decisions in the future. So what happens is we allocate that funding to the locals, and they in turn place those seats, determine eligibility for their the number of seats that they have been awarded. We also have 15 Ready Start networks who are participating in a really cool and innovative supply building and access expansion opportunity. So these are our Ready Start networks who have kind of taken things to the next level and really gotten the ball rolling on addressing the 4 pillars. And at this point in time, they are doing a community-wide assessment and seeing, is there any way they can, with the stimulus funding we have at hand at the moment, expand supply and access to childcare for our youngest learners in their community. Still in the early phases of that, so hopefully this time next year, I'll be able to report to you some exciting progress that's been made there. And finally, we are pursuing codifying Ready Start networks in policy. Everything related to community networks that I spoke of before is already in policy. And like I said, that is being paid for by CCDF and state general funds. And so moving forward, once PDG goes away and once stimulus funding goes away, we want to make sure Ready Start networks are still in place and no longer a pilot. So we're going to try and codify them. And also we're going to have to be very innovative in trying to figure out how we continue to fund them. So with that being said, I think that I have reached the end of my presentation. So I'm going to stop the screen share. All right, thank you. Looking forward to talking with some of you some more.
Okay, so I've done this twice now. Thank you, Lizzie. That was a great presentation, a lot of great information. So what we're going to do now is we are going to have some breakout rooms, and this is going to be some time for you to maybe ask some more in-depth questions, just have conversations. So we have 2 breakout rooms set up. One of them will be titled Virginia and one will be Louisiana. And so we're going to go in there about 18 to 20 minutes or so, and then we'll come back and have opportunity if there's additional questions and questions, or if people want to share some things that they talked about in the room, we'll have time for that as well. So Annie, if you want to open the breakout rooms up, and we do have a question there. The slide decks, I believe, should be on the site. I'll check that while we go into the breakout rooms and get back to you on that. So you should be able to select a room. Okay. If anyone's having trouble joining a room, just you can just come off mute and we can help walk you through that.
Hi, I didn't see any window pop up yet.
You didn't see, so
I can move you into a room. Would you prefer to go to Virginia or Louisiana?
It doesn't matter.
Okay, I'll send you to Virginia.
Thank you.
If anyone else isn't seeing the pop-up, just let me know. Speak up and I'll put you in a room now.
Yeah, I'm not seeing it either. So if you could put me in the Virginia room, that would be great.
Great. I see there's still 4 people here. Oh,
Yeah.
3. Anybody else like to be placed in a room?
It could be, maybe they walked away.
I'll just assign them to a room so they come back over there.
Okay. Yeah, I'm gonna go check that on the website. Yeah, I'm gonna check that on the website and then I'll jump into one of the
Okay, great.
rooms.
And I made the room for 20 minutes, but now it's saying it was 15. So I'm going to check and see how I can add it because that's annoying. Let me see.
Oh, huh. Okay. Okay. Um, mm. So, mm. Mm.
No, why? What happened? What happened? Oops.
Hey, Annie, I think I might have accidentally closed our room early. I'm sorry about
I
that.
see. I was like, I just extended it. What happened?
Some button came up and it was like
Oh,
close
no.
room and I clicked it and I think I made a mistake, but we can
All right.
continue talking in here.
Yeah, you folks can chat in here. Go ahead.
Yeah, because it's the same people. Sorry. Thanks, Annie. All right, anybody else got anything on their minds that's going on in their state that they want to share or ask about? It looks like we're getting more folks.
Looks like everybody's back.
So Lizzie and Erin, I don't know if you all want to address, I was looking on the presentations. Oops, yeah. And I did not see them, so I don't know if that was something you all could upload or just provide to me and we can see about putting up, or if that's available for everybody.
Yeah, I can email it to you, Stephanie, but I can also just drop it in the chat right now
That would be perfect.
for anybody that's still on the line.
Oh, I can try to do that too.
And one other thing that I shared with my breakout room that I forgot to incorporate into my presentation is that actually UVA is a partner for both Virginia and Louisiana, and they did some research on our Ready Start networks that was published. So I'm going to drop it in the chat if anybody's interested in reading that. They did research on our very first cohort.
I'm gonna try to do this too. We'll see if I'm successful or not. Yeah, but absolutely happy to share those slides and anything else that is helpful. I think you're muted, Stephanie.
Oh, this is not my day. I've done that 3 times. Goodness. Yeah, so we just have like 10 more minutes. If anyone wants to, have any final questions or anything you wanted to share from what you all discussed. And we certainly aren't adverse to ending early. This is your time. You've got some great minds here to question. So whatever y'all want to do.
It looks like Jeannie from Minnesota raised her hand.
Yes, I have a question. I guess it's for both of you because I'm wondering what type of data you might be collecting at the state level from each of these community hubs, and are all of the programs that participate contributing to that? Do you get any? Do you have Head Start programs that are giving data to the state in any way? Just curious.
Yeah, that's a great question. So one thing Virginia is currently drowning in is data that we're collecting from our PDG Community Networks. That really comes through 2 avenues for us. The first is what Lizzie just mentioned. So if you check out that website, we are both working very closely with UVA to do a bunch of research. And for Virginia, what that looks like in PDG is a set of annual surveys for families and for teachers that are giving us really, really valuable insights into what's being experienced on the ground. It's been incredibly powerful data during COVID, but even before, and I'm sure in whatever the future looks like, will continue to be really valuable insight. That includes participation from all of our programs, so every publicly funded provider type, and we've really been able to get great participation rates. I think largely because we have the community network structure in place, there's that kind of direct contact outreach. We've also done some gift cards and stipends and recognition via PDG to kind of support and get that data. We've seen that be really successful. We also have built through PDG a new data system that we call Link B-5. And this is a kind of, we call it cascading. It goes from community lead to site director to classroom to teacher to really collect a catalog of information about every program, classroom, teacher, and now even including children, class lists of the sites and kiddos that are in PDG, which is now really big and a lot of data. So we're now kind of in the place of what do we do with all of this, which is a great place to be in, but have definitely learned a lot from that.
I'll jump in and add that we, like Virginia, collect site level data, including a child count from each site, the class quality scores from each site, and they also submit informational metrics. The community networks do. So I'm going to share my screen for just a moment. We have a website called louisianaschools.com, and you can look up any publicly funded provider to get some of that information that we collect. I just looked up the first center that I found, which was ABC Head Start Center, but you can look up their star rating score, a little bit of basic information here. But if you go to the second tab, we have classroom quality measurements, as well as how it compares to the rest of the network, and how it compares by age range. But even at the bottom, we do collect these informational metrics on ratios, what assessment tool they're using for their publicly funded kiddos, how quality their curriculum is. This clearly doesn't serve infant toddlers, so how quality their pre-K curriculum is, and then how prepared teachers are at each site in terms of the degrees they've earned and how are they certified with the state of Louisiana. So we have a lot of data as well, but we put it out there in a public way so that parents can make informed decisions about where they send their child.
Thank you. That's great.
Andrea?
Yeah, I was hoping to ask, and I hope this isn't way off topic, but I'm curious to know if through your networks you've been able to implement any stronger workforce supports. And obviously you're focused heavily on quality and teacher preparation and whatnot, but like in the crisis we've been in and the nationwide need to raise the pay and the benefits of early care and education workers, to be advocates for them, to support their mental health, et cetera. Like, have these networks addressed that challenge, and how?
Yeah, I'll pop in first here, but just tell me if you want to go first, Lizzie. Yes, so one really cool and important feature of our PDG grant is something that we call the teacher recognition program. And really even from year one, before the renewal, we were doing a direct from state to teacher stipend for all teachers participating in PDG. So year one, that was $1,500 per teacher, just straight up a check that we cut 3 times throughout the year to provide some financial support and recognition for not enough, but something towards what we really need to be supporting this workforce. We were able to do some like pretty cool learnings from that the first year. Also with our partnership with UVA, really seeing the impact that even just $1,500 had on retention on the childcare workforce. I don't think anybody here will be surprised to learn that, but to see it in black and white was pretty powerful. and a huge learning from just a 1 year, what at that time was a 1 year grant. So it was, obvious that we were going to continue that forward and have expanded it. So last year we enhanced our teacher recognition program to be $2,000 per teacher. We've stopped providing it to school-based teachers. We now only provide it to childcare and family day home. We just did not see the same effects in school-based, and with limited resources have picked those that need it the most, and are continuing to expand that for this year. Everybody's eligible for it if they stay throughout the term of the academic year. And we do, verification throughout the year to make sure that the teacher's still there. They have to be working with children 30 hours a week to qualify for it. An additionally kind of cool feature of that is, we had such a great success of that even after the first year, we were able to get some state investment for that teacher recognition program. So it's $5 million this year from the state to support that teacher recognition program and kind of back us up on that. We're working hard to build a case to expand that even further since we're getting bigger and bigger, but I think that's not what we have always thought of when we think of workforce. As you said, I think credentialing, professional development, all of those things go into it. But when we look at what the field needs now, that's been a really important part.
I'll jump in. I think that, first of all, that's really cool, Erin. I don't think I realized that you guys were doing that. And I know in Louisiana, I think you mentioned mental health. We have a large contract with Tulane Early Child Mental Health Consultation that is available for centers to use. And available, actually, we expanded it for a telehealth service for any individual that cares for young children, kind of qualifies and can take advantage of it. So that includes parents, teachers, childcare staff, etc. In terms of workforce supports, we've used some of our stimulus funding to give workforce grants to childcare centers, and also some of our community networks have received community recovery grants that they had autonomy over what they decided to do with that funding. And most of them decided to do workforce incentives as well. So I heard about one parish, for example, that was collecting kind of the similar data in Virginia, just on a parish level, of how well that has, after implementation, that helped with retention of teachers. So that's been really neat to see as well.
Thank you so much. Yeah, I'm also just really thinking about long-term sustainability and raising the base wages, and how these types of partnerships you've pulled together might be able to bring in business community investors or philanthropists or others like that. So, but thank you. Yeah, it's really great to hear that that's happening in your states.
Okay. If we don't have any more questions, we have like 3 minutes. So let me go ahead and switch to my closing that I'm sure you all have seen, but let me go ahead and share. And just thank you again, Lizzie and Erin. This was great. I love that we did the breakout rooms and allowed opportunity for folks to really kind of dig in a little bit deeper about what you're doing. So really appreciated that. So just want to remind everyone that with the PDG B-5 TA Center, we do have a lot of resources out there that are available for you to look at. And I'm going to drop the link in the chat. Actually, these are 2 links that I'm going to drop in. And we also, just a reminder, there is this early childcare and early education research connections is available as well. And that link is in the chat also. So, the conference this year, we really kind of focused on data systems, equity, finance, governance, social emotional development, and special populations, and just coordination and integration. And this website also has a lot of information that you may find useful on that as well. So that concludes our session, and I hope everyone's enjoying the convening. We've got a good plenary coming up next. I believe it's some states presenting, like I think it's like an interview type format, so that should be informative. But thank you guys. I thought this session was great. So a lot of great information. So everyone have a great afternoon.
Thank you.
Oh, and come to the networking tonight. It's so much fun. You can ask Richard anything you want. So, that should be an incentive. So, okay.
Always
Everybody
great.
have a great afternoon. Thank you.
Thanks, bye.
Bye, thanks.
Chat.